March is National Kidney Month, which is bringing awareness to kidney disease and living donor transplants.
Yeah, UofL Health's Dr. Gaurav Rajashekar. We're going to go with Dr. Raj, you said everybody goes by, because I knew I would screw that up. Anyway, Dr. Raj is in studio to tell us more about kidney disease and options with living donors. So thanks so much for coming on. We really appreciate it.
Oh, thank you. Absolutely.
Such an important topic. And let's talk about the risk factors, first of all.
The number one risk factor for kidney disease is diabetes.
Okay.
1 in 3 patients with diabetes have chronic kidney disease. So it's really important to identify it really quickly. The other conditions are hypertension, systemic conditions like lupus and IgA, and even patients who are taking like chronic NSAIDs for like back pain and stuff like that. If they're taking it for multiple periods of time, higher dosages can cause kidney problems. So identifying these risk factors early on by primary care and referring them to nephrologists is really critical to either stop the progression of kidney disease or even, retard it.
And what are some signs that someone at home might notice that they are struggling or that they need to actually see someone like you?
That's an excellent question. And the most important thing is kidney disease does not present with signs and symptoms unless it really drops to like 20%. If your kidney is functioning at 100%, only when it drops to 20, you'll start seeing the physical signs and symptoms. It's usually picked up on labs, but you can also see patients with like lower extremity swelling, like when their legs start to swell up. That means they're leaking a lot of protein. And the kidney has very intricate function. That's why I went into nephrology. As you retain these toxins in your body, what happens is you become more sleepy, you become more somnolent, you become more confused, you develop nausea and vomiting. And these are some of the signs and symptoms that you can notice with kidney problems.
Tell us about a living kidney donor and what does the process look like?
So the most effective treatment for end-stage kidney disease or advanced kidney disease is transplant. There are 2 types of transplant. There's deceased donor kidney transplant and there's living donor kidney transplant. But the most effective one is a living donor transplant. And why is that? It's always done in a controlled environment. And if you have a patient or a recipient whose kidney function is worsening, and if they have a living donor, you can transplant them immediately and they don't even need to go on dialysis. And it's done in a controlled environment, and the kidney, as soon as you put it in, starts making urine, and that's a very good sign. And any of them can be donors, right? If the patient has any spouse or their kids or their parents or their relatives, or even altruistic donors who come out of the blue and are like, I want to donate a kidney. That's awesome. And you can immediately transplant them and they don't have any side effects or any complications that present with dialysis. So transplanting them early with living donors is critical because the wait list right now is around 3 to 5 years if you're on the wait list. And that could be really detrimental to patients who are on the wait list.
And just quickly, is the risk low for people who are living donors?
So what happens is when you donate a kidney, prior to donation, at UofL, we go through a rigorous checklist, and we go through them so much that those patients, those donors become really good, healthy donors. And they usually get discharged the following day after donating the kidney. And their risk is not high after their donation because they live a normal life.
Wow.
That's good to know because we see so many people with the signs that they need a kidney.
Yeah. Good to know it's a good option. Thank you so much for coming on.
Absolutely.
We really appreciate
Happy
it.
to be here.
Thank you, Dr. Raj. All right, but first.